Good afternoon. I'm Afe, FMB students. I will be doing HEENT exam on you today. Before I get started, do I have your consent to conduct this exam?
Yes, you do.
All right. So I will start with doing a general visual examination of the center strip of your head, looking for any rashes, bumps, bruises, or any kind of discoloration or any issues with the hair distribution, and there is none. All right. There are no bumps. I'm going to go ahead and palpate. Still palpating for bumps, bruises, any hair discoloration, or any issues with your hair distribution or rashes, and there are none. All right. Now I will palpate, starting with your occiput. All right. Your post-temporal, post-ocular, preocular nodes, your temporal vein, all right, your SMJ, say ah, all right, palpating your tonsils, all right, palpate your submandibular tonsils, all right, the submental tonsils, all right, and I'm palpating your occipital sinus and your maxillary sinus, all right. And also your frontal sinus. I palpate your frontal sinus and your maxillary sinus. There are no issues there. Now I'm going to go ahead and inspect your ears. All right, so I'm going to start with just looking at the general inspection of your pinna. All right, on the other side, doing the same thing, and I don't see any rashes, bumps, bruises, or discolorations around your ear. All right, I'm also looking for any discharge from your eardrum, which I don't see any. There's no discharge. All right, also doing the same thing on this ear. There is no discharge or any kind of discoloration within your ears. Now I'm going to do a quick test. All right, I'm going to close your ear and tell me what you hear. Okay, so you can hear, there are no issues with your hearing, all right? So I am going to conduct the Rhinese test, all right? Now, what I'm going to do with this here is I'm going to place it in the bone of your ear, all right? And tell me if you can hear, all right? Okay, you hear the tuning fork? Tell me when you stop hearing it.
I don't hear it.
Can you still hear it?
I can still hear it.
Okay.
I don't hear it.
All right. I'm doing the same thing on the other ear. I'll place this on your mastoid bone. All right. All right. Tell me when you can't hear it anymore. All right. Can you still hear it?
Whoa, yeah, it's loud.
All right. All right. Tell me when you stop hearing it.
I'll stop hearing it.
All right. So your AC is better than your BC. Your air conduction is better than your bone conduction. There's no issue there. Now, what I'm going to do is I'm going to look into your ear. All right. I'm going to put together my otoscope here. All right. So with my otoscope, I'm going to look into your ear. All right. What I'm going to be looking for is any kind of cerebral impaction, any kind of swelling, cuts, redness, or bruising in your ears, all right, and cerebral impaction. Now for an adult, I'm going to pull up and back. For a child, I pull down and back, all right? You ready? Okay. Now, for safety, I'm going to use my finger here to guard against your ear to make sure that I don't injure your TM, okay? All right, so I see no cerebral impaction. There is no redness, bumps, swelling, or depression, cuts, there are none, all right? The ear is patent, and I see the cone of light on your right side at 5 o'clock, all right? And I see the head of the malice, which is in the right position, all right? Okay. Do the same thing on the other side. I'm going to look into your ear, all right? All right. Looking for any redness, cerumen impaction, which is none. I see the cone of light, which in your left side is at 7 o'clock. I don't see any cerumen impaction or drainage, or and the head of the malice is also in the right position. 9 o'clock. Upright as it was. No issues there. So your ear is patent, and there are no issues there. Okay. All right. So now I'm going to move into the inspection of your visuals. All right. One's pretty intense, so just bear with me. All right. So initially, I'm going to just take a general survey of your eyes. I'm looking for any redness of your sclera. All right. I'm looking at your conjunctiva. It should be white, and if it was yellow, I'll be worried about jaundice, which that's not the case. Your pupils on iris are reactive. They're symmetrical. Your eyelids, I don't see any ptosis, or I don't see any exophthalmos. All right. Your eyes are symmetrical. All right, and there are no issues there. Okay. Now I'm going to do a quick test. All right. I'm gonna do a quick test here. Give me a second. Just trying to open. All right. So before I finish here, I'm also going to look at your lacrimal ducts to make sure that there are no issues with swelling or discoloration of your lacrimal duct. And I'm going to pull down real quick just to make sure. All right. So no issues with your lacrimal duct. Everything looks in place. All right. So we're going to do a quick test with the Snelling eye chart. What I want you to do, first of all, you wear glasses or contacts. Okay. So your vision will be corrected. Look at this right here, closing your left eye. And tell me what is the smallest line you can see.
The last one.
Okay.
LTFPH.
Thank you. And change.
LTFPH.
Very good. Now with both eyes, what can you see?
LTFPH.
Good. Now we're gonna do a test just to check for your the color acuity here. What color is that?
Red.
All right. And how about that?
Green.
All right. Looking at this here, I can tell that your eye is the 20/20 vision corrected, and you have no issues with seeing colors. The size of your pupil is about a 9. All right. So now we're going to do an inspection of your eyes, looking for consensual and non-consensual vision fields. All right. So I'm going to place this right here while you look straight at me, just to examine your pupils and your iris. I'm looking for reaction to the constriction of your eyes with the placement of my light, and it constricts with this eye and also with this eye, so that's consensual and non-consensual. Look straight at me, please. Thank you. All right, same thing. I see constriction of this eye and also this eye, so we have consensual and non-consensual pupil constriction, which is a normal finding. Now I'm also going to just examine really quick. All right. I can tell that your eyes are round, reactive to light, and they accommodate light with no issue. So it's round, reactive to light with normal accommodation. All right. Turn that off right now. Now I am going to also just look at your eyes in general, and what I'm going to be looking for here is checking your visual the optic nerves of your eyes. Right. So what I want you to do for me, first of all, I'm going to conduct a test called a confrontational test. All right. So I'm going to place my finger here and tell me if you can still see it as I advance forward. All right. You ready? All right. Can you see it?
Mm-hmm.
Good. All right. Now I'm going to do a test. It's called a convergence test. I'm going to do it from the back. Tell me where you can see it. Can you see it?
Yeah.
Okay. Tell me where you can see it.
Yeah.
Okay. Can you see it?
Mm-hmm.
All right, good. So no issues with your convergence and your confrontational. Now we're gonna do the optic nerve test. All right. So I'm gonna move my finger and just follow with your eyeballs or your pupils and your iris. All right. Don't move your head, please. So just go ahead and follow my finger. All right. That's cranial nerve 6. All right. Cranial nerve 3. Cranial nerve 3. All right. Cranial nerve 4. Cranial nerve 4. Cranial nerve 6. 3. No issues there. All right. So I just completed the test of your cranial nerves, and I don't see any issues. Now, what I want you to do is just open your eyes. All right. All right. So there's no issues there. All right. All right. So the next test I'm going to do is your smelling test. But before I do that, I'm just going to make sure there is no nystagmus in your eyes as well. All right. So there's no nystagmus. All right. Or ptosis. All right. So let's move on to the smelling test. So for the smelling test, what I want you to do for me is, first of all, just close one nostril. This is lemon. All right. Close your left nostril for me. All right. Close your eyes as well. All right. All right. I'm going to bring a different scent. All right. This is going to be something that you don't know. Close your eyes. All right. And close one nostril. Tell me what you can smell.
Cinnamon.
Thank you. All right. Do the same thing. Close your eyes. All right. Hold your other nostril. All right. Tell me what you can smell.
Orange.
All right. That's awesome. All right. Now, also, I want you to do is try to breathe in for me with your nose. Just close one and breathe in. Do you feel any issues with breathing? Good. All right. Do on the other side as well. Breathing, no issues. Good. All right. So now the next thing I'm going to do is I'm going to use my ophthalmoscope here. I'm going to look into your nose. All right. All right. So I'm going to look in. All right. All right. I'm looking for any impaction, any nasal drainage. I'm looking for the turbinates and your mucosa. And your mucosa and your turbinates, well, your nose nostril is moist and pink, and there's no unusual drainage, and your turbinates is in the midline, and your nostril is symmetrical. Do the same thing on this side. All right, moist and pink. Your nostril is symmetrical, and your turbinates and mucosa are in the right position. There are no issues there. All right, so I'm going to move on to the next test here, and this is going to be a test of just looking in your mouth, okay? I'm going to use my light as well. Starting this test, the first thing I'm going to do is I'm going to look for symmetry. I'm looking for symmetry and ensuring that there is no unusual facial drooping, all right? And there's no signs of unusual cuts, erythema, or bruising of your lips, and there are none. All right, so the next thing I want you to do for me is say ah, okay? Say ah. All right. All right. So I'm looking at your dentition, looking for a normal dentition. All right. Your dentition is normal. All right. I don't see any cavities or any gingivitis in your gums. I don't see any swelling in your salivary glands, and your salivary glands have normal function. There's no unusual dryness. All right. I also look for any gingivitis. I'm looking at your uvula. All right. Your hard and soft palate are normal with no bumps, bruises, or inflammation. Now say ah for me. Say ah. So what I just tested is your cranial nerve 9 and 10. All right. And then when you move your tongue to the left and the right for me, all right, I just check the strength of your tongue motion, and that's your cranial nerve 12. I'm also going to look inside, all right, looking for tonsillitis, all right, looking for any unusual pustules or formation in your tonsils, and I don't see any. Your uvula is in the right position, and I look at your palatine, the palate of your tongue, and there is no unusual discoloration or any signs of tonsillitis or maybe an upper respiratory infection. So it seems, so based on all my assessments, there are no issues with your oral cavity. Okay. Now, let me just turn my lights off, please. So now, I'm gonna go into the inspection of your neck, all right? So with inspection of your neck, what I'm going to start by doing is I'm looking for symmetry, all right? I'm looking for symmetry, all right? I'm looking for any unusual tracheal deviation, all right? And there are none. There's no tracheal deviation, all right? And I'm going to also just palpate, all right? Facial tracheal deviation, and your trachea is midline. All right, so for landmarks, all right? So we have your cricoid right here, right? Your cricoid cartilage, and under that is your thyroid, right? So what I'm going to be checking there is to make sure that there's no unusual swelling, all right? So there's no unusual swelling. Now I'm going to, from the back, I want you to try to swallow for me. I'm going to simulate that this is, well, I don't have any.
Okay.
All right, here's the water, right?
Yeah, sure.
All right. Now I want you to drink your water and swallow for me. All right. All right. Swallow and swallow. Okay. So when you can swallow fine. Your thyroid is in place, so there are no issues with the swallow test. All right. Now for my next test, I'm going to just go ahead and check your neck motion. So for the first thing I want you to do is rotate your neck for me clockwise, all right, and counterclockwise. All right, that's very good. There's no issue with your range of motion. Now I'm going to put my hand, against your temple. I want you to push against resistance for me. Push it to the left. I'm looking for range of motion. All right, the same thing. All right, there's no issue with the range of motion. And then turn left for me. All right, checking your sternocleidomastoid. And do the same thing on the other side. All right, there's no issue with range of motion. Now I'm going to check for your shoulder shrug. All right, you have normal shoulder shrug strength, no issues there. And I'm also going to palpate for the tonsils around your neck. All right, so this is your subclavicular tonsils. They should be pea-sized and they are pea-sized. I'm also going to do the same thing on the bottom here. All right, these are infraclavicular tonsils, and there are no issues there. All right. Okay. So I just conducted the test for your eyes, your nose, your mouth, your throat, and your ears. And based on my assessment, I don't find any major issues. All right. And do you have any questions for me so far?
Just sometimes my eye, something in the back of my eye. I don't know. I have history. Sometimes I know my mom has diabetes.
Okay. So when I look into your eyes, I'm going to do a test for your eyes just to check to see if you have any issues there. All right. So the first thing I'm going to do, based on those findings, is I'm going to be checking to see if you have any occlusion in your eye, any cloudiness in your eyes. All right. So I am going to go ahead and take a look. All right. Mm-hmm. So I'm using my ophthalmoscope to look into your eyes to see if there's anything I can find from that finding. So I'm going to first of all. All right, so I'm going to look in with my right eye. I'm going to be looking in your eye. Okay, I'm looking for any unusual discoloration. All right, so I'm going to look in, see what we can find there. All right, take a look straight for me. All right, so what I'm looking for is the red light reflex. All right, the red reflex. I'm looking at the cone of light. The disc ratio is 1 to 3. All right. I'm doing the same thing on this side. My ophthalmoscope, like it looks straight. All right. And now I'm closing my left eye. I'm looking in your left eye, just so you know. All right. I'm looking for the cup to disc ratio there. All right. The cup to disc ratio is also 1 to 3. That's each normal red light reflex. Okay, now look into your eyes. All right. I don't see any kind of of dust or debris in your eyes. Your cornea is white. There are no issues. There is no redness to the vessels of your eye when I look in. All right. There's no unusual cuts in the vessels of your eye. They're round and reactive to light. The lacrimal duct is in place, and there's no sign of cotton wool spools. All right. All right. Or cloudiness. So you don't have any issues with glaucoma. All right. Do you have any questions for me?
No, that's it. Thank
All
you.
right. Thank you.